I'm Kutlar. I'm a hematologist here at GRU, Georgia Regis University. I have been working on this disease for over 30 years now. I came here 32 years ago. I did some laboratory research here in the Sickle Cell Center, and now I continue to work both in the laboratory aspects and clinical care of sickle cell patients. Well, the public should know, first of all, it's an inherited disorder, and then you get it if you inherit one gene for sickle hemoglobin from each parent. And the second important thing is it's not confined to African Americans, although in this country it's primarily African American, but if you go to the world, it's found all over the world, in the Mediterranean, in India, and so forth. And third important thing is, although it may be considered an orphan disease, it's very important in its impact in terms of medical economics because it causes a lot of suffering, hospitalization, and increases costs. So I think knowing this and knowing the basic facts about the disease so that the complications can be minimized or handled, I think is going to be very important, and that goes with education, essentially. I am happy to say that over the last 30 or so years that I've been involved with this disease, we have made significant advances. There's been a lot of research which has given some good results, and as a result of this, the life expectancy of our patients have increased dramatically. They live longer, they live better. We have at least one effective drug in hydroxyurea. There are more that are coming down. I think one of the important aspects of developing new treatments for this disease is research, clinical studies, like we are doing. And I think I have to tell that our patients have done a great job in participating in these studies, because it's these studies that ultimately lead to the development of better treatments, better drugs, and improve the overall health and well-being of our patients. So I have to say our patients have done great in this regard and have served the community very well, and we have to appreciate that. We were talking about research is an ongoing thing, and it always leads to advances, and I think it's important to keep research in this area through NIH funding and funding through other sources. Now, you mentioned hydroxyurea. It's not a cure, but it's probably the most effective drug that has so far been developed for sickle cell disease, and I think it has a lot to do with the improvement in the quality of life of our patients. I think our challenge now in terms of the usage of hydroxyurea is to increase the usage and utilization of hydroxyurea, and that would happen only if we can work together with the physicians in the community and our patients in the use of hydroxyurea and make it wider because of its known beneficial effects. On top of that, there are other medications that we are developing, not only like hydroxyurea, but in other aspects, to help patients who come into the hospital with crisis, to treat the crisis, to shorten the duration of crisis, to improve their pain, and of course, you know, the curative measures are bone marrow transplant, and recently there have been some significant advances in bone marrow transplant, both in the care of the patients after transplant and in the availability of donors for the transplant. And we're really looking forward to that. And we're launching a transplant program here at our institution with the help of our transplant experts to the adults. So in the near future, we expect that this will be available to more and more of our patients so that they will be cured of this disease. Well, yes, I think, again, I would urge the public at large to learn a little more about sickle cell disease, know what this is about, and I would urge our patients, number one, to take good care of themselves, and to leave the myths that this is a disease, I can't do anything. And there are very good examples of very successful individuals among our patients with sickle cell disease who have done great in their careers. And I think this is not something that should drag people down in their lives, and I think they should continue to be optimistic and live a full life.